Every day in the U.S., 130 people die from an opioid overdose. Sometimes the drugs are obtained illegally or they can be prescribed by a doctor for pain relief after surgery. In the wake of an epidemic of opioid addiction and deaths, there is a growing movement among surgeons to find other ways to successfully manage post-surgery pain. Tonight in Your Health, Oxycontin, Percocet, Vicodin. For years, they were a mainstay of pain management after surgery. Plastic surgeon Lauren Nigro says she and many of her colleagues recommend non-narcotic alternatives for patients, even for procedures that require weeks of recovery time, like a tummy tuck.
A lot of it has to do with the size of the cuts we're making, and a lot of it has to do with also sewing those muscles together.
But the doctor says for the past several years, there's been a movement to treat pain before, during, and after the procedure. Before, patients are often prescribed Tylenol or other acetaminophen for several days. During, doctors administer a long-acting nerve block that can last 3 or 4 days. After, doctors sometimes prescribe the non-opioid gabapentin, non-steroidal anti-inflammatories, and in some cases, an injection of Botox.
There's actually a substance in it that it inhibits the substance P, which involves the pain pathway.
Dr. Nigro says it's important to use the pain management methods before and during surgery, so patients are not suddenly in uncontrollable pain after, which leads to taking more than needed. With Your Health, I'm Shelby Kluver. Doctors do still prescribe opioids for pain relief and chronic conditions, but in some states, doctors limit the prescription to 10 pills or just a week's worth of medication. And our coverage of health news can also be found at WQAD.com. Just head over to our website and you'll find Your Health in the search bar at the top of the page. In fact, you can find all of our Your Health stories in that section of WQAD.com.